really don't know. Then you must ask the big chief. Look at them. Yeah. It's like, yeah. I don't know. 1, 2. Samuel. Shamire. Shamwere. 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 Shines. Shines. Yo, yo, yo. Shamwere. 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 What a one, man. Shamwere. Sam. Namibia, Motherland. Are you good? Where to now? 1, 2. Samuel. Shamuere. Shamuer. Yo. Huh? Samuel. Samuele. Yo. 1. Yo. One, two. 1, 2. 1, 2, 1, 2, 1, 2, 1, 2.
Okay. Good morning, fellow Namibians. This is the 35th time we are engaging in this exercise of briefing the nation on the situation of the COVID-19 pandemic in the country. This is a commitment of the government to communicate public information in a consistent, transparent, and accountable manner. It further demonstrates that we have not and will not avoid doing what is necessary to protect the lives and secure the livelihoods of our people against this deadly enemy. Through concerted actions, we have put in place and with the cooperation of the Namibian people and the grace of God, we have been able to curtail and suppress the pandemic. Although the war against COVID COVID-19 is not yet over. We are making inroads and steering our ship ever closer towards the shores of recovery. In the year of resilience, despite untold losses, pain and suffering, we have come together as Namibians and demonstrated our collective ability to withstand adversity and rebound from difficult life events. Through resolve, determination, and the will to survive, we have continued to withstand the heavy weight brought on us by this invisible enemy. Our limits have been tested. We are bent, but we are not broken. It has been said that where there is a will, there is a way. And together as Namibians, we'll find the way. Although we are aware that there may be many more challenging days, weeks, and months ahead, let us be encouraged that through our collective strength and the support of friends from all corners of the world, we have stemmed the tide of despair and can see on the horizon the hope of a return to normalcy. I commend all of you, the Namibian people, for your compliance and cooperation to this end. Information and data gathered by the National COVID-19 Dashboard Monitoring Cluster of the period from 16 September 21 to yesterday, 14 October 2021, indicates that Namibia has been observing a marked decline in the number of new confirmed COVID-19 cases and deaths across the entire country. The subsiding number of cases is attributable to a number of factors, particularly public compliance to COVID-19 public health regulations. We should not take this respite for granted. It takes active steps to bring about a reduction in the numbers, and it will require active steps to ensure that the trend is maintained. The COVID-19 vaccination coverage is showing signs of progress, especially in regions that have borne the brunt of the pandemic historically, such as the Harta, Karas, Chomas, and Erongo. During the period, we recorded an average vaccine uptake of 2,871 doses per day. This figure has declined compared to the daily uptake a month ago. There is need to do more on this regard and get more people vaccinated. Nationally, vaccination coverage currently stands at 19.5% of total population for those who have received their first dose, while 15% of the population today are fully vaccinated. Once again, I implore all eligible Namibians to come forward and get vaccinated. We have a collective responsibility to ensure that all Namibians are safe from spread of COVID-19. Thus, getting vaccinated is our responsibility to ensure the safety and preservation not only of Namibia citizens, but humanity at large. Fellow Namibians, with the trend of declining COVID-19 positive cases, decreasing hospitalizations and deaths in the country, the Cabinet met this week to deliberate on the next dispensation of the public health regulations. Informed by available data and consistent with the approach of evidence-based decision-making, I will today announce further relaxation of the measures in our national response. The current COVID-19 public health regulations will expire at midnight tonight, Friday, 15th October 2021. The following regulations will come into force for a period of 30 days from Saturday, from 16th October 2021 until midnight Monday, 15 November 2021. 1. Public gatherings as defined in the regulations have been adjusted to 200 persons per event. Spectators at sporting events are permitted up to 200 persons per event. Having just returned from the United States and also watching my football matches on TV, the stadia are packed, but they are packed with people who have their passports, vaccination passports. They all have to show that. Even when you are entering the shops, you will be asked to show their passport, vaccination passport. So we are saying, yes, we relax these measures, but it will be good that people can carry vaccination passports. 2, the curfew will be suspended altogether, allowing for greater economic activity, particularly with respect to long-haul public transport operators and the entertainment industry. 3, restrictions related to liquor remain as is. The Minister of Health, the expert in those things, will give the technical information, but it's maintained as it were. 4, business operations. All recreational places such as nightclubs, casinos, gambling houses, betting houses, and gyms may continue operations as allowing patrons up to half a capacity, as we agreed. 5, burials of persons who succumbed to COVID-19 or whose deaths are COVID-19 related must continue to take place within a period of 10 days. On-site consumption of meals at all gatherings, including burials, will now be permitted. The restrictions on the number of persons attending burials of 20 applies to mourners only, excluding essential workers. 6, in this regard, I implore all citizens and business owners to enforce the infection control and prevention measures of wearing a face mask, hand washing, physical distancing, and avoiding overcrowding. Equally important is raising public health awareness on vaccination among customers. Fellow Namibians, I would like to thank all members of the public for their cooperation and adherence to the public health measures. Although we are relaxing the measures, this does not mean that we have defeated COVID-19. I repeat, although we are relaxing the measures, this does not mean that we have defeated COVID-19. If we are truly committed to eliminating this scourge from our communities, then we have a collective responsibility to continue maintaining absolute vigilance. Let us continue to safeguard the gains we have made by applying all the diligence and precaution in our personal contact. Prevention will always remain better than cure. COVID-19 is evolving, and the measures to combat it effectively must, as a matter of necessity, also evolve accordingly. Therefore, should the situation deteriorate, although we pray and hope that it will not, the government will respond appropriately. Let us continue to hold hands and maintain the front as a united, resilient, and unbreakable nation. Together, let us continue to march on the front lines of this battle towards victory and onwards towards recovery and prosperity. I thank you, and now I will ask the Minister to just elaborate where necessary. I thank you.
Thank you. Thank you very much, Your Excellency, the President, Vice President, Right Honorable Prime Minister. Let me first apologize. I was visited by Murphy Law that my system started to misbehave, and I was not very successful to bring it. So my documents I will be moving from one screen to another as a result. My apology for that. Since the 34th COVID-19 public briefing on the 14th of September 2021, our country has experienced a positive trajectory in the overall COVID-19 performance. In terms of epidemiological trends over the past few weeks, we observe a decline in new infections, decreasing hospitalization generally, decreasing number of severely and hospitalized persons and deaths, a declining positivity ratio among those being tested for COVID-19, and receding numbers in terms of case fatality ratio. These statistics are indeed encouraging, and they tell a story of the effectiveness of the measures we have put in place to suppress the further spread of the infection. This relief provides a window of opportunity to continue to strengthen the country's preparedness and response mechanism. As at 14th of October 2021, the country has recorded a cumulative number of 128,214 confirmed positive cases. Of these, 97% have recovered. A total of 2.7% of persons infected lost their life, amounting to 3,534 persons since the beginning of the pandemic. The number of active cases nationally has declined to a total of 870 cases, as per statistics recorded until yesterday. This is a positive development in our national COVID-19 response and preparedness. It is a situation that we should guard through concerted actions going forward. Continued, united, and collective action will ensure that we reduce the number of active cases even further. While total elimination of COVID-19 active cases down to zero is a challenge owing to our land-like connectivity to bordering states, we should aim to suppress further spread of active cases. The positivity ratio in the country declined further during the period from 10% to 2.4%. The World Health Organization recommends a positivity ratio of less than 5%, which we have managed to maintain since the 20th of September 2021. This rate of suppression has brought the epidemic under control in all regions during the observance period. Currently, only Oshana and Ohangwena region record higher number of sporadic cases of 510 and 140 cases respectively over the period, mainly from among the learners. Testing remains an important pillar to identify a possible cluster of infections. Namibia testing coverage remained high, with a ratio of 276 persons tested per 100,000 people in the country. Positive trends on improvement of facility to respond to the pandemic are also being observed. Government has upscaled investments into improvement and expansion of our capacity and readiness for possible future eventualities. In this respect, we have enjoyed the understanding and support from the public sector. COVID-19 has created new demands for beds, mortuary space, and oxygen. We can report and inform the nation about the completion of a number of infrastructural projects implemented as part of the COVID-19 preparedness and response. I will cite only a few of them. For example, the Namibia Chamber of Commerce and Industry has donated a 40-bed tented ward at Oshakati Hospital. A 12-bed prefabricated isolation facility at Okahao was commissioned on the 3rd of September 2021. A 12-bed prefabricated isolation facility at Okahanja Hospital was also commissioned on the 7th of October this year. Further, an 8-bed prefabricated isolation facility was commissioned at Karasberg Hospital and handed over on the 5th of October 2021. The construction of Andara and Ishwarango Hospital's 12-bed prefabricated isolation facilities are on track and anticipated to be completed towards the end of this month. The construction of 15-bed ICU at Keetmanshoop Hospital is completed and was already commissioned on the 7th of October 2021. The scoping for construction of ICU at various district hospitals was concluded at Utapi, Ochivarango, Rundu, Khobabis, Mariental, Engela, Opuo, Mariental, Ochivarango, and Nankudu hospitals. These are in addition to various completed projects that I have shared with the public previously at various platforms and occasions. The government has invested in the servicing and repairs of existing mortuaries. This is to enhance the functionality and increase the capacity of mortuaries. The capacity of mortuaries at public health facilities has been further enhanced with the acquisition, donation, and installation of refrigerated mobile containers at Windhoek Central Hospital with a capacity of 80, Mariental with a capacity of 25, Okahanja with a capacity of 38, Ochivarongo, Utapi, Onanjokwe, both with a capacity of 38, Khobabis with a capacity of 25, Tsumeb with a capacity of 40, Maruru capacity of 25, Usakos with a capacity of 25, and Karibib Health Center with a capacity of 6 cabins. In addition to the constructions of the isolation facility, freestanding oxygen generating systems have been installed and commissioned at Mariental Hospital, courtesy of Namibia Foundation and the other private sector entities. The government continued to upgrade oxygen supply, generation, and storage at various hospitals. I'm also pleased to inform that the Welsh government, through the Cardiff University and UNAM, has initiated the procurement of oxygen tanks, Khobabis, and Grootfontein, as well as an oxygen generating plant for the Katima Mulilo Hospital. The national COVID-19 vaccination program continued to make progress. However, the uptake falls short of the projected targets in terms of where we want to be. While the country target is to vaccinate 750,000 persons of the 1,501,041 persons targeted for vaccinations by the 13th of October 2021, only 288,692 or 19.2% people have so far received the first dose of vaccination, and 213,294 persons, or 14.2%, are fully vaccinated. This we would like to compare with the regional average, where we have, for example, by the 13th of October, the South Africa has fully vaccinated 16.51% of the population, while Zimbabwe, Botswana, and Zambia have vaccinated 16.3%, 10.4%, and 1.6% respectively. The government and stakeholders regularly review and monitor the vaccination data and performance. The slow uptake for vaccination triggered several interventions to move Namibia closer to achieving its target. Among these interventions are: 1, a collaborative initiative, technological innovation between the government and the Mobile Telecommunication Limited, MTC, to increase vaccination uptake, referred to as Namibia Vax Up 081 incentives, which is to be rolled out. And this initiative will incentivize people who are getting their first dose of vaccination. I encourage our compatriots who are not yet vaccinated to take advantage of this initiative and get vaccinated. I would like to commend the MTC management and their team of technicians and innovators for coming up with this technological intervention to promote public health. This is in line with the World Health Assembly recommendation on health digitalizations and technological solutions for health. We look forward to more exciting innovative interventions from the public and private sector institutions to address public health issues. The Ministry of Information and Communication Technology, in collaboration with the Ministry of Health and Social Services, is implementing road shows with participation of local artists to mobilize the public to get vaccinated. With sufficient doses of vaccine currently available in the country, all regional health directorates are also preparing to launch intensified vaccination campaigns in their respective regions to offer vaccination to those who are not yet vaccinated. In addition, COVID-19 vaccination is now available at antiretroviral clinics, at workplaces, at old age homes, at social pension payout points, at shopping malls, and other places in addition to the established vaccination sites. These strategies are yielding positive outcomes in terms of increased uptake for at-risk populations. Namibia, as we all know by now, has acquired 5 different types of COVID-19 vaccines, namely Sinopharm, AstraZeneca, Johnson & Johnson, Pfizer, and Sputnik 5, in order to satisfy the appetite of the public. The government continues to increase human resource capacity and footprints at the facility level across the country for improved service delivery. For the period from the 15th September to 13th October 2021, under the dispensation of the expiring COVID-19 regulations, 188 persons were recruited This is a combination of medical specialists, medical officers, registered nurses, enrolled nurses, social workers, drivers, occupational therapists, pharmacists, radiographers, health program officers, cleaners, and other cadres. They are providing the much needed improvements in service delivery. The government of the United Kingdom's emergency management team was deployed in Namibia for about 5 weeks and provided capacity building to Namibians through training of nurses and doctors responsible for case management from various COVID-19 facilities in 10 regions. The training included basic and advanced life support, infection prevention and control, and management of critically ill patients with COVID-19. We have also witnessed the law enforcement officers in full force to ensure public compliance to the public health regulations. These efforts in civic education at community level, coupled with epidemiological interventions, have brought about the positive trends we have witnessed in recent weeks regarding the suppression of the spread of COVID-19 pandemic in Namibia. I now transition to expand more on some provision of the amended regulations as announced by His Excellency the President. 1. The requirement for entry into Namibia. Now, persons permitted to enter Namibia must present a SARS-PCR negative test from an authorized laboratory in the country of departure, which test results should not be older than 7 days, calculated from the date the sample for testing was taken. Namibia will accept authentic de-isolation certificate from previously infected travelers who are still testing positive with PCR test at the point of entry, regardless of nationality. The certificate has to be valid for at least 3 months from the time of issuance. The above provision applies to travelers who present vaccination certificates. The Ministry is exploring the use of digital certificates to identify the technology suitable for use in Namibia for inbound and outbound travelers. This technology is already being used elsewhere, especially in Europe. Now, for Namibians who intend to travel to Europe, they must take their vaccination cards along. Entry into public places like a restaurant is only permitted after having provided proof of full vaccination against COVID-19. So treat your vaccination card the same way you treat your identification document or your passport. As has been announced by His Excellency, the number of public gatherings has been increased to 200 persons per event. There is no longer a requirement to maintain an attendance register at that event. However, there is a requirement for enhanced public health measures. With the lifting of the curfew, there will be increased business activities and human-to-human interactions. We encourage business owners to encourage patrons, employees, and customers to be vaccinated. We have just emerged from a devastating third wave of COVID-19, which claimed a lot of precious Namibian lives. COVID-19 found a fertile ground for transmissions because the Namibian population is non-immune to COVID-19 and is therefore highly susceptible. There is a direct correlation between the vaccination status of the population and the number of new infections, hospitalizations, and deaths. We have an opportunity to avert another catastrophe by boosting our immunity through vaccinations. On restriction related to liquor, the regime as it's at the present moment remains. And perhaps the Minister of Justice or Attorney General, with the permission of His Excellency the President, may wish to elaborate a little bit on that, because it remains as it is currently, with a new element that the curfew have now been lifted. Our healthcare workers have saved the country through the 3 waves of COVID-19 infections with dedication, compassion, and commitment. They have witnessed unprecedented suffering and deaths, and they are getting exhausted. Let us not cause them to suffer compassion fatigue and burnout. This can happen if we remain on unvaccinated population, which will mean that many people will feel sick, and then when they get sick, they are going to overburden the health institutions and the healthcare workers. We can spare the health worker this trouble. Once again, I call upon all fellow Namibians to do the right thing to get vaccinated. The campaign being rolled out is aimed at getting more people vaccinated in the next 2 weeks. More Namibians should get vaccinated and complete the vaccination schedule ahead of the festive season. Let us remain one step ahead of the pandemic. We have the opportunity and the means to do so. Vaccination is safe. Let us believe what the government is telling us to do. I thank you, Comrade President.
Thank you. My colleagues, of course, can come in from high table if they want to. Legal people, there any interpretation, any things that you have to clarify? That side?
Thank you, Your Excellency, and Vice President, Prime Minister, colleagues. I believe that most of the amendments have been clearly explained and also elaborated on by the Honorable Minister of Health. Just to highlight the issue about the selling of alcohol, as we all know that there are various categories of licensees who sell alcohol. The licensees who are allowed to sell alcohol for off-site consumption like retail shops and supermarkets, those ones shall continue to sell from 9 o'clock to 18 hours from Monday to Friday, and then from 9 to 1 o'clock on Saturdays. Similarly, the bars, clubs, and other places of entertainment, they are allowed to trade from 9 to 11, I believe, from Monday to Saturday. But however, they are not allowed to sell liquor on Sundays and public holidays. So restaurants and accommodation facilities and similar establishments are allowed to sell liquor from Monday to Monday up to 11 o'clock every day, including public holidays and Sundays. I think with those few clarifications, and I think as it has been said that the exact regulations remains as is, I think that actually explains the situation with regard to the selling of alcohol. Just to elaborate on something that Your Excellency have mentioned, with the relaxation of the restrictions, I think you need to emphasize that it shifts the responsibility from the law enforcement agencies to individuals. So it's a collective responsibility that we share, that we take more responsibility for our own lives and for the lives of our loved ones. I thank you, Excellency.
Any additions? Explanation of the
Your Excellency, I just want to clarify that in light of the fact that we don't have a curfew, many of the liquor outlets, particularly businesses, would have to rely on the provisions of the liquor license that they hold, the special liquor licenses that they hold. I know that special liquor licenses in particular actually provide a timeline by which you should either close your business or by which you should end the selling of alcohol. So I want to just clarify that because the curfew is no longer applicable, it will have to be a situation where people who sell alcohol at business establishments would have to rely on the conditions that are stipulated in that particular special license. The second issue, Your Excellency, that I want to clarify is that the provision about capacity still remains in place. We must really avoid a situation where spaces are overcrowded. We don't want to see a situation where simply because we said 200 people, people are being crammed into particular business spaces and entertainment areas. And it's very, very important that those businesses, shebeens, clubs, gambling houses, that they must still maintain when people are not eating or drinking at that particular establishment, they must keep their mask on, and they must maintain some social distancing, and they must ensure that there is provision made for sanitizing the washing of hands and so forth. Please, I think it's important now that we are opening up the space, we are really placing the responsibility on members of our public to take serious measures to ensure that we remain that we continue to reduce the further spread of the virus. Thank you.
Thank you very much. Any other comments, clarifications? If there is a case, I will open the floor for questions related to our submission. Questions?
Good morning. My name is Charmaine Gashihewe from the Namibian newspaper. Mr. President, the first question is for you. You spoke about, or you advised Namibians to carry around their vaccination cards, and then you made reference to your time in the US. Do you think Namibian businesses should make entry to their premises dependent on whether they have their vaccination cards? And perhaps are we headed there? This is for the Minister of Defense and perhaps also the Minister of Justice. In terms of the mandatory vaccination of soldiers, Minister of Defense and Justice, I would like to find out, while it must be encouraged that the majority of Namibians must be vaccinated to curb the spread of COVID-19, the recent reports suggesting the mandatory vaccination of soldiers border on the violation of human rights. What does the Minister of Defense say to this? And then also Justice can come in. Dr. Shangula, this is for you. I have a few, I'll send them to you on WhatsApp as well. Is the ministry discussing the administration of booster shots? And do we perhaps have an estimated timeline of when the ministry will work to administer these shots, the booster shots? Additionally, do we have any statistics of people who have had adverse effects taking the vaccine? There was another case. Has the ministry concluded the investigation regarding the death of that specific man who had allegedly taken the vaccine? And then, yeah, that was last, I think earlier in the year. We have not heard about that. And then also in terms of curfew, Dr. Shangula, I would like to inquire, with, time and again, you would say curfew has been enforced to reduce the number of infections. What has changed now? What has motivated the government perhaps to suspend curfew altogether? Are we not risking a high rate of infection, especially seeing that experts are speaking of a fourth wave? Thank you very much.
Very good. I was just telling you what I have seen, what I have experienced. Once you enter a public place, they were asking for your vaccination card. And I like my sports. Even here when I'm watching the Premier League, it's crowded. And I would say, how come these people don't have even masks and so on? And they are crowded, no distancing. And I would say they all have to present their vaccination cards. That's what I was informing you about my experience. Vaccination, it's not the first time we have vaccinations, by the way. We vaccine our children, we have all kind of polio, what you call it. We have vaccinations happening there when I was a young boy. So we're acting as if this vaccination is a new thing that just came after COVID. It's still voluntary. You have your freedom. But I said your freedom stops where other person's freedom starts. And the national common good, those are the things to look at. Why do we always fight on our simple things? That is just meant to safeguard our lives and reactivate the economy. Who would like to punish Namibians? Who would like to punish them with vaccination? Why? Why really? To gain what? So it's voluntary, but definitely it's for common good. And the world is doing it. It's not only us. But if you say, I don't want to be vaccinated, don't mingle with us also. Maybe go to the village, to my farm, and stay there alone. So you cannot affect other people. But you cannot endanger the life of other people because you have your freedom. That's all we are saying. Why is there misunderstanding about these things? It's a straightforward question. Common good for our own life. People are dying. We have been burying people. There was a time I was so worried. I said, what is happening here? People are my friends, dying just like that. So not making a joke. It's a serious matter. But we are relaxing it now. We are not punishing anybody. You can see from relaxation. When we see there is some improvement, we relax. So we can start our business activities because we have to think of economy too, about the jobs and so on. But let's balance everything. Let's hold hands. Why is there a war? There's no need for a war. We're just talking about our common good. Next question was to Minister. The defense? Defense come? Since you have vaccination.
Thank you very much, Comrade President. Thank you for the question. Your Excellency, soldiers occupy a very special space in our society. They are the only group of people that live in barracks. They don't live in single quarters, they live in barracks as a group. They operate as a group. They don't operate as individuals, they operate as a group. They are the only people that are taken care of by the state in terms of their meals, in terms of their dresses, uniforms, boots, and all the tools they use. So they are not like me and you. We have deployed soldiers to vaccinate, to bury many of the COVID-related or COVID deaths. The burial are conducted by the Defense Force members. They do this and they return to base. So if they have to travel to go for military training elsewhere, outside Namibia, they are required to meet the standard or the health requirement of the country where they are going. And they are not there waiting. They are not told when they are leaving. You are leaving tomorrow. No. They can be told any time to undertake any mission anywhere. In missions, some of them go to joint meetings, joint operation meetings, SADC standby force, etc. So it is not punishment, as our commander-in-chief is saying. It's not punishment, but it is to look after the welfare of these troops. It's not about their rights. It is about their health and the health of others. So we must just accept it is done for the good cause of our soldiers, and there is no need to politicize, as I see it happening now, that people have the courage to incite soldiers to use their guns and defend themselves against their leaders. It's kind of the extreme part of our democracy, that you incite soldiers. I hear there are those that I'm told are getting involved in petition the president. I believe those are not soldiers. These are just people who are disguising themselves as soldiers. A soldier, the life of a soldier is a life of a soldier, and you believe in what you are told by your commander. I have been one, and I know what I mean, what it means to be a soldier. Comrade President, thank you very much.
Yes, soldier, you spoke now. What is the other question? Yes, Minister of Justice.
Thank you very much, Your Excellency. In addition to what the Minister of Defense has said, actually research that was done both by the Ministry of Justice and also recently by the Legal Assistance Center actually found that there is a provision in the Defense Act 1 of 2002 that specifically provides that in the event that it is required, soldiers would be subjected or could be subjected to mandatory vaccination. So the law that governs that particular profession actually makes provision for it. And I do want to maybe just indicate that Section 81 of that Act specifically talks to compulsory immunization and prophylaxis. And I'll leave it at that for the defense question. I do want to just make the following point, Your Excellency. There is a reason why at this stage government has not taken a hard stance on mandatory vaccinations. We have kept it voluntary for the following reasons. Initially, when this conversation started, we did not want to think about it in compulsory or mandatory terms because there weren't enough vaccinations available in the country. Because that is one of the requirements. At least when there is a decision made about whether or not to make vaccinations compulsory or mandatory, you need to ensure that the service that you need to provide in that regard is freely available to a large contingent of our society. It is now the case that we have a bouquet of vaccines available and that is accessible to a very large contingent of our society. So that's the first point. The second point, of course, Your Excellency, is when you live in a constitutional democracy such as ours, with a Bill of Rights, you do want to ensure that should we take the decision, which we have not yet formally taken as a government, should we decide to take that decision, what we would want to make sure is that that decision is reasonable, that that decision is proportional, and also that it takes into account a number of issues. For instance, employers would be required under the Labour Act, at least the provisions of that act requires this of us, to at least consult members of that particular employment space about the reasons why they are taking the decision to have mandatory vaccinations. That conversation at that particular platform is extremely important so that people understand why they are being subjected. And also, as part of that conversation, it would be, what is the risk in that particular space? The Minister of Defense had just explained why it would be important for members of that particular defense community to be subjected to compulsory vaccination. It's important for members of that community to understand the risk associated, for instance, for not getting vaccinated. The other, Your Excellency, is under the Labour Act at least, there is a whole process that is set out in sections 39 through to 46, I believe, that sets out health committees, for instance, that need to be established. So it is not just about subjecting employees to mandatory vaccination, but it is also a question about following the processes that are set out in the Labour Act so that we are all on the same page, if you'd like, about why there is need for us to do that. The last thing I want to say, Your Excellency, is that we must also consider when we talk about mandatory vaccinations that there will have to be some exceptions. There are reasons why certain people, for instance, would not want to be subjected to mandatory vaccinations. It's important that those exceptions are set out. It could be health reasons, it could be religious reasons, but the ultimate is that we, at some point, the independent arbiter in our society, which are the courts, may have to, at some point, make a firm determination about whether or not mandatory vaccinations are offending the provisions of the Namibian Constitution, whether or not the pandemic that we are fighting is reason enough for the greater good of our society, reason enough to subject all of our society to mandatory vaccinations. But for the moment, what we are doing is we are looking at all the options, and there's been quite a bit of comparative work done. And I'm sure at the appropriate time, the Attorney General would provide the advice that is required to make a determination as to which direction Namibia should take in respect of this particular debate. Thank you very much.
Thank you very much for the elaborate explanation. And throughout, all of us are just saying it's for common good. Nobody is being punished. For what? Is there Any other questions still outstanding, not answered? Yes.
Thank you very much, Excellency. I will address the question from Charmaine. The first question related to the discussion on the booster shot. The first point is that we are not preoccupied with that question at the present moment. We are still trying to get people to have the first vaccination. Currently, that is our preoccupation. The first vaccine. The first vaccination will offer already some degree of immunity. Then we encourage everybody who got the first vaccination to go for the second one. Now, the booster is the tail end. Before we get to the booster, the first thing we should need to do is to do a study to determine whether the level of immune response which has been induced by these 2 doses is waning or not. If you may only go to the booster if you have evidence that the immune response, the level of immune response has weakened. We are currently preparing ourselves to undertake that type of investigation. And only after that, we can make an informed decision to say the current level among the populations which has been vaccinated, the current level of immune response, it has weakened and they need to be boosted up. The second question related to adverse effect following immunization. We have on several occasions indicated that vaccines, COVID-19 vaccines, like any other vaccines, like any other pharmaceutical product, they have side effects. They may have side effects, but not everybody would experience the same side effect. I have also on this platform given an example of side effect from malaria tablets, and then one will have to take a decision to cure the person from malaria or to allow the person to die of malaria. So there is a balance which one needs to take in that regard. Yes, indeed, some people experience side effects of vaccines like mild headache, chills, fever, non-specified symptoms, certain individuals. I know of some people, they may experience some nausea or even vomiting. But other people, like myself, I moved from my office, from work, I went to the vaccination site, got my jab, went back to work. I felt not a single thing. So the point I want to make is that each individual will experience something different from the other. Some will go home to sleep, some will not do so. But each and every adverse effect following vaccination is documented and thoroughly investigated. WHO have produced a protocol which we are following with each adverse reaction, we do use that protocol for the investigations. Now, there was an incident where it was alleged that a certain individual died following vaccination. We know about that case because any death outside the hospital is regarded as unnatural death. That case was investigated. A postmortem was done. The cause of death was established. It's unrelated to vaccination. Further toxicological examinations was conducted. Results are still outstanding, but there has been thorough consultation with the family, and an understanding was reached with the family regarding that particular incident. The last question is about the curfew. The curfew is a very, very important tool in the suppression of COVID-19 transmission. Let me take you back to how COVID-19 transmits, and I usually say that an individual is both a host and a vector. Now, COVID-19, the virus moved from an infected person to an uninfected and susceptible individuals. Now, that is the basis for person-to-person interaction, human-to-human interactions. Now, the curfew serves to limit human-to-human interactions in order to break the transmission chain. At the present moment, we look at the epidemiological profile, and then we see that there is a room for the curfew to be lifted, because curfew also limit other human activities which are necessary, so that those can get also an opportunity to be undertaken. So that is the rationale behind the lifting of the curfew. Should the situation change, as His Excellency have mentioned, the government will again look at measures how to mitigate further transmission. And therefore, it is very important for us at the present moment that we should not relax in implementing public health measures, and that we should get as many people as possible vaccinated. The other question which I received from Sheligan, would you like me to answer it, or we are going to say, okay. The question related to what WHO set the target to which countries should strive in terms of vaccination, that at least I think it was by September, 10% of the population must be vaccinated. So that was the target set by WHO, that member states must strive to have, by September, to have at least 10% of their population vaccinated. We have not, we must understand that in order to achieve that, member states, they did not start vaccination at the same time. Namibia only started vaccination towards the second half of March. And that was only a pilot vaccination in two regions, that's Erongo and Khomas. Nationwide, we only started towards the end of April. Now, somewhere in between, the supply of vaccines became a problem. And there were actually instances where we have suspended the vaccination campaign due to non-availability of the vaccines. So those factors mainly compounded the performance of Namibia at the beginning of the vaccination campaign, not to have advanced much. But currently, we do have the vaccines. I have already mentioned that we have 5 types of vaccine. You can make your choice. The only other problem which we have now is the hesitancy of the population. And we are addressing that particular problem through different approaches and incentives, etc. We may not be satisfied with what we have done so far, but we still feel that there is a room for improvement. And we might be in a position to at least protect a big number of Namibians from COVID-19. I thank you.
Last round.
Morning. I'm Dwight from Eagle FM. Just 2 questions, but they're very direct. For Minister of Health, Doctor, if we have to look at the last answer you gave, now with regards to the deadline of our vaccination program, is there a revision as the President had outlined in terms of the relaxation of the curfew and also the encouragement of business enterprises to try and recover in the activity? Is there the amendment to that vaccination total from September now? Is there a different date? And then secondly, I know that the Minister of Safety and Security is not here, but just for the Minister of Justice, as the Minister of Defense had indicated that the NDF does fall in a specific bracket, but if we have to look at like members of the police force, which form part of the emergency services, is there also a similar type of program perhaps to incorporate them into a mandatory vaccination? Because countries around the world, especially the US, just to add on to what the Minister of Defense has added, they have actually indicated to their Navy that those that refuse might see dishonorable discharge or honorable discharge for refusal of the vaccine. That's now a second expansion on that question to the Minister of Defense and to the Minister of Justice. Is there such perhaps an outlook point with regards to members of the NDF who might still refuse till the last to take the vaccine up? Those are the only 2.
Yes.
Yes, Minister, I can't send it yet because I don't have your number as yet. Just to ask directly, is there a change in our vaccination deadline in terms of when people can, or is there a limit to a revision to September's date that you mentioned that the World Health had set for Namibia? Is there an amendment to that time period in advance, perhaps?
I would prefer if you could just forward that so that I don't miss what your intention. Thank you.
Yes.
Thank you very much. Once again, Your Excellency, thank you for the
Minister, for recently, so we can talk.
For the question, I'm happy you are following the world trend. When we raised that, when we said the world is doing that everywhere, there was all kind of statement being made that now we are getting orders from other countries. The world is, Namibia is being led by people from outside. This kind of negative kind of approach is not helpful. So we don't believe that we will come to that point where we will have to send our soldiers home because they don't want to vaccinate. I think common sense would prevail that, you know, when you are there with your comrades in arms, you must care for their health. They are trained to rescue others, help them in times of danger. So they should do the same in this case. You should care about the health of your fellow soldier. And I don't think, so far we have not seen that any indication that suggests that we will come to that point where we will have to honorably discharge them or ask them to leave. We are not yet there. And I don't think we will ever come to that point. Thank you, Mr. President.
As to police.
Well, police is yes and no, but you see, the police is a different system. Because you see, they don't share so common dormitories. They don't. Yes, they work together, but a police can work alone. Soldiers, you will never see a soldier deployed alone. They are always together. Police operate, sometimes police one or two, but they also live separately. Police lives like me and you. Soldiers not. So I don't think that is really necessary. But it is absolutely vital that they all vaccinate. But in terms of, I don't know what the Police Act says, but we have done this following the provisions in the Defense Act. Also, Your Excellency, the number of death that we have experienced is very high. So we lost quite a good number of our men. So it was not just something that was arrived at a thumbs up, that you just do it, because I believe CDF and his high command must have pondered around this point to say, what do we do to save our men from this pandemic? Thank you, Comrade President.
Thank you very much, Your Excellency. Again, I must just reiterate that there is no right, at least in the Namibian Constitution, that is absolute. And when we deal with a public health emergency such as this one, we really must think about the greater good of the society in which we live versus the individual rights that people have. So there are limitations, but those limitations are also subject to certain criteria. And that criteria is the whatever right you limit the limitation must not be so great that you completely lose the essential or material aspects of the right that you are violating. So I do want to say that I'm not aware that I don't think there is a specific provision in the Police Act that deals with mandatory vaccinations. The statutes that are generally dealing with aspects of risks and health are the Labor Act, I know the Defense Act, even the Correctional Facilities Act actually has a provision that specifically looks at when there is an outbreak, there may be required that there is mandatory inoculation of inmates, for instance. There is some references in the Child Care and Protection Act that also deals with what should the test be when you are faced with a public health emergency versus the protection of a particular child, for instance. If you look at the now repealed 1919 Act, Health Act, 1919 Act. Actually, it made provision for mandatory vaccinations back in the day. That's why when we were growing up, you'd go to school and you would get vaccinated and come home, for instance. So I think the test really is that vaccine, if it's going to be mandatory, is it proportional? Have we taken into account the environment in which we find ourselves? Are people aware of the decisions that they need to take about whether or not to take mandatory vaccinations, or to use other reasons why they cannot take it? And I think we must take into account people's reasons why they may not be comfortable in taking that particular vaccination. But the Minister of Health, under the Public Health Act of 2015 and Environmental Health Act, he actually has some powers. It's not specific on mandatory vaccinations, but it says the minister may actually take any measures that may be required to prevent and control the further spread of the virus. What that means is at any particular time, if in the considered view of the minister, the virus is getting out of control, he may actually take particular steps to ensure that we control the further spread of the virus. And that may, at that particular time, include mandatory vaccinations. But at the moment, I think the government is taking it slow. We want to encourage more and more Namibians to take vaccines voluntarily, but also to express their views on what the reasons are why they don't want to take vaccines at this particular juncture. Thank you very much.
On that note, I would like to thank you, Vice President, Prime Minister. We call it Defense Force. To defend what? Defense Force. To defend what? The country. What is country for what people? It's a people. So if people are dying, Defense Force have to join in seeing that the lives are saved. Same of the police. And we are here together in this thing, not to quarrel over who has to be vaccinated or not. It's a common good. Even UN people are talking about it. It's a common good. We are in this together. And more so in a small country, Namibia, small population. We have to safeguard first our economic livelihood and our people's health. That's why we are appointed, that's why we are elected. You cannot come and just throw things to kill the people. We are here to defend the people, to protect them. Police, army, all of us. So we will talk to them. We are going to see them very soon, somewhere at some ceremony. So we'll engage them, the army people and so on. But I would like to thank the world, actually. The world is united in this war against this virus. Namibians are united. I'm really proud that the private sector, all of us, regard it as a common enemy. Therefore, let's hold hands and fight this enemy. I'm glad that the numbers are going down. Please, don't let me come back here to declare curfew. Thank you very much.